Hello everyone. Today I want to talk about selective neurectomy surgery, what it can and what it cannot achieve. It is very important to underline that this surgery, as currently done, was found in 2018, which means it's 8 years old. So it's a relatively new surgery. And until now, about 6 reports have been published about this surgery, and very recently in a very esteemed journal, me and a colleague of mine just published the 7th series in this subject, which consisted of some of our patients who were followed at least 1 year after this surgery. And so it has been the 7th report published so far. So although there's relatively scarce data on the subject, I had videos to explain how this surgery is done, and this surgery can improve lots of deformities on the face. The way I like to view it is I like taking the video of the affected side before surgery, and the right way to evaluate the success of the surgery is to compare this video with the post-operative video of the affected side, and to make the patient say, I'm glad I had this surgery. So let me underline this once more. As said in Latin, restitutio ad integrum, which means going back to normal topic. So it was published in Facial Plastic Surgery and Aesthetic Medicine Surgery with my colleague. And we followed patients for about 1 year, and the details can be read online. But when we look at the results of the surgery, the blues show the preoperative scores and the orange bars tell us the postoperative scores. But if you're going to give a message about this, as you can see here, this very big difference is the asymmetry in dental show, which means when we smile, we make a line from the midline and we count the teeth, which is a very, very practical method of evaluating the asymmetry. So on the healthy side, we count the number of teeth, visibility in the upper teeth and the lower teeth, and we compare the healthy and the paralytic size. And as you can see in this chart, the dental show with smile was very significantly increased in our case series, which means we are doing a very good job in general with the patient's smile. And the upper lip height, lower lip height, and commissure height, these are also parameters that show how much the mouth corner moves up when we smile. So in these areas, we are doing a relatively good job. And this is in consensus with the previous 6 reports. Where we need more improvement with this surgery is so this was the conclusion of our series, is the eye closure, the squint that happens with smile. That's where we need new data, more surgeons working on the subject. Yes, we get very good improvements in some patients, but unfortunately not all patients. And in this area, we are pushing the limits of surgery, but always safety should be the first priority. But we are pushing I'm sure this will improve as well in the future with more surgeons working ambitiously on this subject. So this is a summary of what this surgery can achieve scientifically, observed and evaluated with softwares that do an objective analysis with the aid of AI, and subjective analysis of the patients, and also subjective clinician gradings. This has been stated, and I'm very proud and happy to be one of the contributors in the field and pushing this surgery together with international colleagues to for better and improved results. And thank you for listening, and please ask me any questions you have in your mind. And once again, thank you for listening.